Welcome to another episode of the Edmonds Mom's Room podcast. We are so delighted today to have Dr. Yusuf of Affinity Contemporary Dentistry, and that is located here in Edmonds. So we cannot wait to get down to business and find out more about what we should be doing for our teeth. And his practice is awesome because he not only helps moms in the area, he works with the whole family, so he will see your children as well. So without further ado, welcome, Dr. Yusuf. Thank you so much for being here.
Thank you.
Okay.
I'm very excited to be here.
Well, thank you so much for being here, and we're excited to hear what you do over there.
Yes. Yes. So we are a general dental practice. So we see everybody from, we've seen 10-month-olds, and we have some centennials. So I think we have a 101-year-old lady who's going very strong.
Nice.
Yeah, so we see lots of families, little ones, and we have, obviously in Edmonds, we've got a nice retirement community as well. We get to see all spectrums of people. Yeah.
Cool. So you do peds as well?
We do. So we encourage first checkup, which we call a happy visit, around 1. Reality, as soon as a tooth erupts, can get decay, so that's a good time just to kind of review with mom and dad what we should be doing at home that age, and then what to expect, moving from that first tooth or first couple teeth to the full gamut of the baby teeth. And so that'll be where we discuss diet and hygiene and all the questions that moms and dads have.
Nice.
And the other thing that at that age is just trying to familiarize with the children with sitting on the chair, all the instruments and what might look scary to them, kind of just introduction, so that as we progress and that next 6 month, maybe we can do a little bit more, and hopefully actually do cleanings and stuff like that when they're young. So.
When does that start typically? The actual cleaning portion?
It really varies.
Yeah.
We've had 4-year-olds that it's just not going to happen at all. And so at that point, we will at least make sure we can do an oral exam. And we've had 1.5, 2-year-olds just open their mouth and let us do it.
Oh, that's awesome.
Go at it. So, and then even with the same child, sometimes it's just not a good day. So we don't force it unless there's something of concern.
Yeah.
And we work with pediatric dentists as well. If there's needs that are beyond us, if they need a lot of fillings or have a lot of cavities, that kind of thing. So.
Okay. Well, that's so nice to hear, because as a mom my kids haven't had any true dental issues yet, but taking them to a separate dentist is super challenging. And I don't want to do that. It'd be nice if we could all go to the same place.
And that's usually what it is.
Yeah.
So we see mom and dad, and then as they'll ask me questions. Mom will ask me questions when she's pregnant about what to expect, and then that first visit, usually maybe she'll be getting her an exam as well, or a cleaning as well, and then on mom's lap generally.
Nice.
But yeah, most people bring their kids, and we kind of push everybody, within that hour or two window to make it a little bit more convenient.
Yeah, cool. Tell us a little bit. I skipped ahead,
yes,
and we got talking about peds, but I think that's really important for all the moms listening out there. Tell us about your passion. Where did this come? How did you become a dentist?
I didn't grow up wanting to become a dentist, or I didn't really know what I wanted to be when I grew up. I was probably most average people would go every 6 months. I didn't really, luckily, need a lot of dental work, so I didn't have a lot of exposure to it. And then in college, I was doing a lot of the typical pre-medical courses, and I was thinking about going that route. And I had a cousin who had recently started dental school, and he encouraged me to just shadow a little bit to see if I would like doing that. And I did. I grew up in Bothell, so I just had shadowed some dentists there, and I just liked the idea of being a little bit more independent and having more autonomy and, working in my own type of practice and having, being able to establish relationships with patients and actually being able to use my hands as well. So that was kind of what got me into it. And then I would say passion kind of evolves as our practice evolves. It used to be fixing a tooth, and we call ourselves a tooth carpenter, and just that was very exciting when we first started. And now, as we learn more and more about relationship between, the mouth and the whole body, as well as we implement new things into the practice, whether it's new procedures or just different ways of doing what we used to do. It makes things fun because there's always something new. And now we're at, I'd say passion also comes from our team we have got great team cohesion, so everybody's on the same page about, trying to provide the best experience to the patient.
Nice. That's awesome. That's one of our goals at Body Motion. Yeah, so procedures. You mentioned procedures.
Yes.
Tell us a little bit about, so you're not, what kind of procedures?
So we're a general office, so we
Yeah.
do a little bit of everything.
Okay.
Day-to-day, what we do the most of is cleanings, and that'll be with our hygiene team.
Cool.
And exams, but, fillings, crowns, root canals, extractions.
Oh, you do root canals and
implants.
extraction. Oh.
We do some limited orthodontics. So what's nice is what we feel comfortable doing, we can do, and then we've got a great relationship with our specialists. So, if it's something a little bit more complicated or advanced, then that's where we'd, work with a specialist, and with the team approach, they would take care of certain things, and then patient would come back to us, and we'd complete everything.
Nice.
So, yeah.
And you guys, so you do implants and all? I mean, that's massive. Yeah. Okay, cool. Well, I'll come to you for my next implant.
All right.
Isn't that sad that I've already had some? But cool. Awesome. Thank you for sharing that.
Oh, well, thank you.
Tell us more. Devin mentioned you have some special programs.
One thing that we are coming to see more and more is patients do not have insurance, or if they do have insurance, it's pretty inadequate, doesn't cover much. So we implemented in an office plan. It's like a membership plan, which will include the cleanings, the exams, the x-rays that are necessary, and then offer a fee schedule that's comparative to like a major insurance, like a Delta Dental, Washington Dental Service.
Oh, cool.
So patients that just, whether it's they're retired or it's not offered, then maybe they work for a smaller company, or they have just lackluster insurance, they can have the same type of benefits as somebody who worked for a Microsoft or an Amazon and has that dental insurance. So that's one of the things that we do in-house that is, I think a nice benefit for patients.
That's huge.
Yeah.
So if you don't have dental insurance, you can pretty much buy your dental insurance in care.
And dental insurance is one of our, I guess, the toughest things that we deal with, because every year they're getting tougher and tougher in terms of what is covered. The maximums are basically the same as they were in the 70s and 80s when, $1,000 or $2,000 would cover a lot of dentistry. Now, if you have any needs at all other than your routine maintenance, you're going to max it out with just one tooth. So we're also, I guess, we try to educate the patients, because, we always think of insurance as what we have for medicine. So if we break a leg, it's going to cover it. Dentistry is kind of the opposite, where it'll cover your first 1,000 or so, but then if you need something major, then it's all out of pocket.
Yeah. I mean, I just always assume that the dentist is going to be so much per year out of pocket,
It is,
yeah. So it's so nice that you guys have an option to really take care of people, it sounds like.
Yeah, absolutely. So we
good.
have, I would say, almost every patient that doesn't have insurance is on that plan.
Cool. That's awesome. And a good thing for people that just don't have insurance, or maybe they do and it's not sufficient.
Yeah, absolutely. So. It's a nice supplemental plan as well.
Yeah. Cool. This is a personal thing.
Sure.
Do you guys have any teeth whitening in the clinic?
We do. We do, actually.
I don't even know. You could have said no, and I went to that.
You know what? That's one of the specials we're running. So we offer three different types.
Okay.
One is an in-office, and that is going to be your strongest concentration, your quickest results, where you sit down, we put a barrier is placed, and then very strong peroxide is placed onto the teeth over 3 or 4 cycles. So it's about an hour procedure, and you're going to walk out with noticeably different, brighter teeth. There's also a custom tray. Have you ever done whitening before?
I have, yeah.
So that's where you have a tray that's made, and you have a syringe that you'd put a little amount in each area, and wear that at 20 minutes to, some people actually even sleep with them, depending on if they have sensitivity or not. Works really well. It's a prescription strength syringe, so it's pretty strong.
Cool.
And then we do an opalescence to go, which is nice if you don't want impressions and just kind of want the easiest thing. It's kind of a one size fits all, like Crest white strips, but it's a stronger concentration and it goes all the way to the back. So that's a good way of doing things as well, and that's going to be the most cost effective way.
Cool.
Some people do a combination of they want something right away and to continue, so they'll do a custom tray and office whitening.
Nice.
So we are running specials up to $100 off on all of those.
Cool. Okay, sweet. Well, that's exciting. So if you need your teeth whitened like me, come to your office. Okay, cool. So we have a question that we play with here in the office.
Sure.
And we don't know if this is safe. I don't even know if this is a legal question for you. But baking soda on your teeth for whitening.
Baking soda, well, there's the baking soda, and now people are doing the charcoal even.
Oh, didn't even know about that. Okay, that sounds a little disgusting for me.
Yeah, so you just want to be careful because baking soda can be abrasive.
Okay.
So, I even tell patients when they're using the whitening toothpaste, it can be a little bit more abrasive. So my concern with that is if it's getting scrubbed in, then we can end up with gum recession, which we see that frequently. Okay. And even we start seeing pitting of the teeth where there's little abrasion marks in the teeth from whitening toothpaste or even brushes that are not soft. So I wish stores wouldn't sell medium bristle brushes, but they do. And
interesting.
A lot of people think, well, this is going to be better because it's a little bit more firm for removing plaque. I mean, that's what I would think too. Yeah. But it actually can damage the gum tissue as well as make little marks in your enamel. So I'd stay away from all those abrasive. That's why we like the gels.
Yeah.
It's not abrasive. Can cause some hot and cold sensitivity. Usually we can do a fluoride application to mitigate that. And then that sensitivity, maybe 25% of people will get that, and it's not a forever type of thing.
Cool. That's awesome. Okay, thank you for sharing. That makes me want to curb the whitening toothpaste a little bit.
I mean, it depends. When I always ask when they say I've got increased sensitivity to hot or cold, what kind of toothpaste you're using. A lot of times they are using the whitening. Yeah. So I say just maybe switch out to either a Sensodyne or a normal toothpaste because that could be what's causing it. So. Okay,
that's helpful. So you mentioned toothbrush. What do you think about? I'm taking this a different way.
Yeah.
But what do you think about like a Sonicare or what do you recommend?
Sonicare is great. Oral-B is great.
Okay.
Any electric's going to do a pretty good job in it. I believe they're all going to be soft bristle brushes.
Okay.
So you can do a great job with the manual, but I think an electric just helps you do a better job.
Cool.
So I use a Sonicare. That's just my preference. The Oral-B is a circular one, so it spins. So some people that have a harder time with a larger head, that the Oral-B is nice because it can get to the back of the back teeth.
Cool.
But that's really preference.
Nice. And then do you have kids?
I do. I have a 5-year-old and a 7-year-old.
Okay. Do you use electric toothbrushes with them?
We use both. So I'm trying to get them. I've still brushed their teeth a bunch, but I don't know if that's necessary for all 5 and 7-year-olds.
Okay. What's a bunch?
If I haven't supervised them for a day or two, I'll make sure I brush them. My wife's a dentist as well, so we're probably a little neurotic about it. But,
my kids wish they had you as a parent then.
So if they brush so they have both. When they use the electric, it's like the mirror's covered.
Okay.
So, but it does a good job. So if they want to use electric, they use electric. It's kind of half and half.
Okay.
So, and then with children also, the little floss threaders or the floss handles are great. I know I have a hard time getting my hands all the way to the back of my kid's molar, but the little floss holders work great for that.
Awesome. Okay. Yeah, that's interesting. I was thinking about getting my kids little electric toothbrushes. Yeah. They're 4.5 and 2.5. But I feel like I could try it.
Yeah.
Why not, right?
And you know what? It's something, if it makes it exciting for them.
Yeah.
So I know there's some of my son, it would tickle him quite a bit. So he'd start laughing. But why not? Make it exciting. So, and they've got lots of cool superhero, princess toothbrushes that are electric as well. So
cool. Awesome. What else do you have to share with us?
I guess since we're talking about
Yeah.
children, I'd say, what kind of toothpaste are you using?
Well, for my 2.5, he still uses the training toothpaste.
Sure.
But the my daughter uses like a princess.
Okay, that's great. So I try to stress the training toothpaste when they're young. Well, fluoride's great for the teeth, but they're swallowing the toothpaste. It's not good.
Yeah.
And I think my son was maybe 3.5 before he could really spit. So
Yeah.
until they can spit, the training toothpaste is great. It's still going to remove plaque.
Okay. What if they're swallowing toothpaste?
Well, if it's fluoridated toothpaste, their adult teeth are developing. So if you ingest too much fluoridated toothpaste, if you drink too much, you'll throw up. But it can cause fluorosis of your adult teeth. So when they erupt, you're going to see little white spots.
Okay.
So you just want to limit it. Drinking water, that kind of thing, until they can spit.
Okay. I've heard that is actually super good to hear because I have heard, don't let your kids swallow the toothpaste, but I didn't know why. And I don't want Chloe to have spotted teeth, so I better. Yeah.
But they make the toothpaste taste good too, right? So then you want to finishing, I guess, with children brushing their teeth. One of the things that we look for in the primary dentition for their baby teeth is spacing between the teeth. So a lot of parents get worried that they have gaps between, but that gaps are actually a good thing. So it allows, because the adult teeth that are going to erupt are going to be wider, so the gaps actually allow the space for them, and it makes it easier to brush because we don't have to worry about getting floss between all those spaces if the brush will hit there. So a lot of times we still need to floss the molar area because there will be tighter contacts, but all the front spaces, if the brush can get there, that's good, and we don't want to worry about the spaces. It's actually a good thing.
Okay. What about the kids that don't have the spaces?
The kids that don't have the spaces may have some issues with crowding, so sometimes we'll refer them early to an orthodontist and just have that evaluated. At a young age, expansion, so widening the jaw can be done pretty easily. So sometimes they will, depending on how much crowding there is, and with baby teeth, they will want to do that just to make room for at 6+ when the adult teeth start to erupt, and hopefully minimize future need for space.
Yeah. So do you guys do orthodontics?
We do some. Usually what we'll see is the adult who had ortho and then lost a retainer, so then they have got some relapse, and some crowding, and it's usually in the front, and they want that corrected. So we'll do that.
Cool.
With big bite problems, things like that, we'll work with the orthodontist.
Nice. Okay. And then is orthodontics later in life bad for the gums? I've heard that it's not like...
Yeah.
Is that controversial?
Well, no, it really depends on the situation.
Okay.
So on patients that have everybody has a different amount of thickness in their tissue. So we call that a biotype. If you have a thin biotype, you're going to be more prone to recession. Recession is where you lose gum tissue. And depending on how much orthodontics is needed as an adult, on patients that have that thin tissue, there is a chance that moving the teeth around will make previous recession worse or cause recession.
Interesting.
However, that can always be corrected with grafting. So it wouldn't be something where you would avoid ortho. It's just a conversation you'd want to have with that patient ahead of time.
Nice. Okay. Awesome. Thank you for sharing that.
Oh, yeah.
Nice.
I did want to, since you see, we work with a lot of pregnant patients.
Yeah.
So I guess the questions that I get a lot, what should be done during pregnancy in terms of dental care?
Yeah.
So dental care is super important when you're pregnant. We're going to be, pregnant patients are going to be more prone to gingivitis, hormone changes. So there's something called pregnancy-induced gingivitis. So we just want to be really diligent with plaque control, really getting in there best we can, because we can see increased bleeding. And I just inform the patients. Sometimes patients will elect to say, I want a cleaning every 3 months or every 4 months while I'm pregnant just because I'm having a hard time with my tissue bleeding. And then we just reassure them that, you know what, this is normal, but just keep things as clean as possible. And you know what, some people get a really bad gag reflex, which doesn't help with oral hygiene when they're pregnant. So, but we can do dentistry when we're pregnant. We prefer to do everything in the second trimester.
Okay.
And then always would like a consult with the OB in terms of letting them know if we do need to use any anesthetic and make sure that's okay. So a lot of the times we use epinephrine, which we just want to clear that with the OB. We can take x-rays. We always use a lead or an apron, which we'd use on anybody.
Right.
But really, we need to know what's going on in there, and the tiny risk of a small dose of radiation outweighs basically the benefit of knowing what's in there and detecting what could be a problem while you're pregnant outweighs any risk of minimal radiation. So, but these are all questions that we get a lot.
And plaque can have an effect on preterm labor. Is that right?
Yeah.
It is one of the causes.
So it's increased inflammation. So plaque and gingivitis, preterm labor. The other thing we see that pregnant patients are at increased risk is obstructive sleep apnea. So we have hormonal changes that can cause swelling up in the nose, as well as soft tissue, which that's our airway. So airway can be compromised, difficult sleeping in certain positions that might not be ideal for breathing. So all of these things can affect how well we breathe and increase the chance of obstructive sleep apnea, which is definitely not something we want for the baby, because that decrease the blood flow to the baby, increased chance of diabetes while we're pregnant, increase low birth rate chances, as well as premature labor.
We don't want that.
We don't want that.
No. Well, cool. Thank you. I think that's very helpful. And yes, we see a lot of pregnant moms and postpartum moms, so I think that will help a lot. So dental hygiene isn't only important after baby, but definitely before baby.
Before baby, during, and
yeah, cool. Well, thank you so much.
Well, thank you for having me.
Yeah, thank you for being here.
And you're only 3-minute walks.
The Edmonds Mom's Room podcast is brought to you by Body Motion Physical Therapy. We help women through pregnancy and beyond so they can live active, confident, and healthy lives.